If you were tuned in earlier to my little rant at the end of last hour, you know, a lot of people are aware that I am a cannabis advocate. I'm an advocate for cannabis reform. And a lot of times when we stay on the subject of cannabis, we can make those arguments for and against, and that's fine. But often I find myself in a position where I am defending patients, such as the call we had last night, basically saying chronic pain, you know, we admit chronic pain is subjective. Chronic pain is also, you know, it's hard to gauge. There's not a whole lot that says one person's pain is more than the other's. It really dependent on the person. And that conversation is the conversation that should be held between a patient and a doctor. And when it comes to chronic pain, it's all fine when it's held in conversations of clinical medicine. But as soon as it enters the realm of cannabis discussion, all of a sudden chronic pain is a farce. And so we're going to dispel this notion that chronic pain is a farce because, frankly, I'm kind of done having this conversation. I am not qualified to discuss the ins and outs of chronic pain, but I tell you who is, Dr. Garrett Powell from the Guam Regional Medical City here joining us. We are privileged and honored to have you here, Dr. Powell. Garrett.
Please, and thank you, Andrea. It's nice to be here.
Tell us a little bit about your specialty and what you practice.
Sure. So I'm a neurosurgeon, and the neurosurgeon is the physician who treats the diseases of the brain and spine that respond best to surgery. So that would be something like a brain tumor, or in the spine it might be a herniated disc, or a broken vertebra, or an accident that leaves someone paralyzed. So all of those things would be what a neurosurgeon treats.
Thank you so much for that, because I like to bring some credibility to this argument, because I am simply a cannabis advocate, and I cannot speak to chronic pain, the biology of it, or the medicine, or how it's treated. But one thing that I do understand is that even the federal government is aware that pain management has become a sort of I don't want to say gateway, because that's kind of a bad word that we label a bad word in cannabis advocacy. But there is an opiate epidemic, and this stems from the treatment of chronic pain and pain management, and that is now leading to an epidemic of heroin. So they're seeing heroin on the rise. I don't really want to get into the particulars of that. What I do want to discuss is kind of the ins and outs of chronic pain,
Sure.
The differences, how it affects different people. Could you give us, you gave some examples, people who have been in car accidents. I know a few who now have chronic pain, paralysis, that type of thing. Tell us a little bit about, on a scale of 1 to 10, what the lowest form of chronic pain could be in a person, and in the extreme cases, what it can be.
Sure, and why don't I give you a little background about how this has also evolved as an issue, the treatment of chronic pain. It's not as if we invented chronic pain in the 21st century. In fact, chronic pain has been around since mankind has been around. We didn't hear as much about it before in the medical industry. There just wasn't much emphasis on it, and it was certainly mentioned and it was researched, but to a small degree, just like there are other obscure problems and diseases that we probably don't remember reading much about when we were younger. But the bottom line is chronic pain is pain that's been present for more than 6 months. There are many, many causes, and we could talk about a few. In the Western societies, in the industrial societies, the biggest cause of chronic pain is spine pain. And of spine pain, it's usually back pain, followed by neck pain. So that's the single biggest cause of chronic pain in the industrialized nations. And it can be due to something as simple as, I mentioned, a herniated disc, simple in the sense that easy to diagnose and often easy to treat, or as complex as a condition where we can't identify anything, even with our sophisticated scanning, our MRIs, our nerve conduction studies, where we can't discover anything that's out of the ordinary, and yet these patients clearly have chronic and severe pain.
And I guess that's where this comes in, and why this conversation is really important. You say that it is apparent that these patients have chronic pain. Well, what are the other things that you can use or observe in patients that lead you to believe that their chronic pain is real?
Well, a couple of things. One, if you watch a person with chronic pain, you can tell just by their movements, how they're sitting, how they're standing, how they get up out of a chair. You can see the pain they're experiencing. They guard themselves to avoid pressure against certain areas of their body. They're careful in their movements. There's a host of other things. There's even some conditions related to nerve pain where even a light touch, now this is a very specific condition called, it used to be called reflex sympathetic dystrophy, and now it's called complex regional pain syndrome, where even just brushing up against their arm or leg can cause exquisite pain that to your eye would just be almost unimaginable. But getting back to how you see it, how you can identify it, first, by simple observation, and second, when you're working up someone with chronic pain, when it's in the area that I can treat, again, let's get back to the spine or brain, MRI scans can often show us where a nerve is being compressed or tugged on, or where a particular bone in the spine isn't supporting the weight it's supposed to support, or where a fracture has occurred that's left an area chronically unstable. So you can see it both in the clinical sense of observing patients and then in the more scientific setting of being able to render a diagnosis because of the great imaging that we now have.
Do you see anything like, because the person is in pain, does it affect their blood pressure? Obviously, a lot of times it affects their sleep. So it can lead to many other things. Are these other things that you would look at, and are they measurable?
Oh, very much so. And so a simple observation, and I very often see this immediately after surgery, is a person's heart rate will be elevated because of the discomfort, because of the pain. It can affect your blood pressure by tending to drive it upwards. We all know about our flight or fight response that we've heard about, where our adrenal glands secrete compounds, epinephrine, norepinephrine, that can, again, boost up our blood pressure. But these patients who have chronic pain, where these systems are constantly under stimulation, not only can they have the problems of an elevated blood pressure, tachycardia, but you can even develop depression, not as a psychological response to the stress of it, but due to actual physiologic changes in the brain. So without getting too much in the weeds on what some of these different pathways are, chronic pain causes profound changes in the physiology of humans.
Thank you. Thank you so much for clarifying that. And I hope, Paul, can we make sure to record this, because I want a copy of this. I want a copy of this because, again, as we continue to advocate for cannabis as a supplement to pain management, and this is for people who tend to feel like they're becoming, a lot of patients do complain that I feel like I'm becoming dependent on my pain, on my painkillers. I need an alternative for my pain management. And then so we often hear people who don't understand the biology and chemistry of cannabis say things like, what about exercise and yoga and things like that? Again, every person should have a choice on how they treat their pain, and what may be effective for them may not be effective for somebody else. So As we continue this discussion, can we move on to maybe some interesting things that maybe you've noticed local patients, what may be more common than you've seen maybe in other places, the types of chronic pain or what those causes may be?
Sure. I am seeing more cervical spine pain here than I do typically see back on the mainland, and that may be because of the heritage of some of the people here. I've seen a lot of what's called ossification of the posterior longitudinal ligament, which is where one of the ligaments in our spine, and typically in our cervical spine and then sometimes in our thoracic spine, will just develop calcifications. It becomes hard like cement, and that can press on the nerves and the spinal cord and cause problems. So unquestionably, I see more of it here in Guam than I do back on the mainland. I see a lot of problems related to diabetes and the peripheral neuropathies that are often associated with that, and that can cause very significant chronic pain, especially in the lower extremities and the feet, sometimes in the hand, but I see it more commonly in the feet. So just those two examples off the top of my head are something that I think stand out, again, as different from back on the mainland.
We have an in-studio guest, Dr. Garrett Powell from the Guam Regional Medical City, a neurosurgeon, talking in some great detail about chronic pain and how that's affecting our local community. We left off with diabetes, so I didn't want that to be at the tail end of our break, Garrett. Can you elaborate on that a little? Because we found out on my last week before I took a hiatus from the afternoon program that 50% of this island population has, what did she call it, are pre-diabetic. Right. And 9 out of 10 of those people are undiagnosed. And so obviously diabetes is top of mind for a lot of us. And so those with manageable diabetes or are pre-diabetic, maybe this could be a motivation for them to make sure that their condition they're continuing to monitor their diet and exercise and things like that. Because if they don't, what could happen? How could chronic pain affect them?
And that's a great point. Yeah, so much of this can be prevented by proper management of your blood glucose levels and following the advice of your physician. But over time, what happens is the little small peripheral nerves in your extremities, and again, especially in your legs and your feet, become affected by these high glucose levels, and it causes the neurons to no longer to be able to transmit the signals properly, and that condition is called a peripheral neuropathy, and there are many, many causes, but by far the most common is diabetes. And patients describe it as anything from an uncomfortable numbness. Some patients will just say, yeah, my feet feel numb. Other people describe it as a pins and needles sensation, and then still others describe it as a burning sensation. We don't have any idea why some patients might just describe it as simple numbness and others relate to it as the burning pain, but both are very well described. Can't predict who's going to get which, but I do see it commonly, and the way it intersects with me is I'll sometimes be called upon to implant a device into the spinal cord to stimulate the spinal cord and block the transmission of those pain signals up to the brain. And it's often very effective for that.
We do have a surge, I think, in activity, sports activity, that type of thing. We do have now MMA fighters that have retired recently in the past 10 years. We have now people running marathons, and this is quite different from in years past. And so I'm expecting that we're going to see more cases as these people realize they put so much strain on their body that this is going to be a growing problem, I could guess, because as locals become more active and become more extreme in their athletics, we're going to start to see more cases of chronic pain locally just from this cause.
Well, yes, and I have treated professional athletes in the past and semi-professional ones as well. And I can tell you that from the repetitive sports injuries that they encounter, that does very often lead to chronic pain later in life, typically in their 5th and 6th decades of life and further on. But you're right. These types of traumas are not trivial in the long term. I mean, it's one thing to injure your knee when you're playing ball in high school. It's another to continue with a professional career where you've already injured a joint and you're having to work through it because that is your livelihood and that's what you do best. So you're absolutely right. We do see chronic pain from these types of activities.
Let's move on to the area of treatment. And again, this is how this conversation came about. Obviously, there are many things that can be done, physical therapy, that type of thing. So we can just start with maybe, again, from the most mild of cases to some of the more extreme cases. What are the different forms of treatment that you can either prescribe in pill form or physical therapy or that type of thing? What do you see commonly?
Yeah, what a great question, too. And again, since I'm a neurosurgeon, so much of what I'm going to see is related to the spine when we're talking about pain. I can tell you myself, I herniated a disc in my back one time after jogging, and it really, really hurt. And I wondered at the time before I had surgery, I did have a friend operate on me, I was thinking, I just couldn't go through life with this kind of pain. And fortunately, in the majority of cases, just like mine, surgery can correct that particular problem. But you're right, there are other types of pain where just working with a physical therapist, regaining the motion of that joint, and I'm thinking right now of shoulders in particular, can make a world of difference in preventing and treating chronic pain. There are other things, joint pain, chronic hip pain, again, where surgical intervention can make all the difference in the world. The person gets their hip repaired and life begins anew for them because their pain has finally been treated. But unfortunately, there are some conditions where even with the best treatment we have, even if you were to go to the most illustrious surgeon for that particular problem, you can still have pain, and that's where we get into the intersection of the pharmacology of treating pain and what's best. And you've already mentioned at the start of your show about the problems with long-term use of opiates. And opiates are the type of pain-relieving compound that are most readily available to physicians to treat pain, and as such, you're seeing a real spike in the prescription of these drugs. And I would say, in fairness to physicians, it's because it's the main arrow in their quiver. In other words, if there's only a few things you have to treat pain, and one of those is opiates, and opiates is the most effective, that's exactly why you're seeing so much of it prescribed these days.
And I completely understand that, and which is another reason why we continue to advocate and push for cannabis. It may not be the be-all, end-all for a lot of people. It may not be the only solution, but surely it can supplement it. There are a lot of people who can attest that cannabis has helped them. I have a sister who has actually had 2 hip replacement surgeries. And the pain she was going through, because it's not one of those elective things like, okay, my hip's going bad, I'm ready for my surgery. She had to endure this pain until they said, okay, you're ready for your surgery. And I just like, can't you just go now? Can't they just do it now? Why do you have to live like this? And she had to tell me, I need these painkillers. And it hurt me to see her often, during the middle of the day in certain zombie, like, I'm not saying she was a zombie or anything, but she just didn't have a normal life from morning to night because she had trouble sleeping at night because of her pain, and then she would end up napping because she would take her painkillers during the day. And so these are the things, again, that I've seen in my life, and that people who do suffer from chronic pain are actually going through. And they want some semblance of normalcy in their lives. It affects, again, everything from their blood pressure to their stress levels, etc. While we're on the topic, are you willing to take a caller? We have a doctor. We have a caller has a question for you. We're going to take a call from Augie, if that's okay.
Excellent.
Hafaday, Augie, you have a question for Dr. Powell?
Yeah, got kind of a few. It kind of leads into the direction. Dr. Powell, are you strictly a neurosurgeon, meaning you only see patients that are referred to you by other physicians?
Yes, I mean, a patient with a neurosurgical condition is welcome in my office at any time, but yeah, I do focus on the brain and spine and peripheral nerves.
No, I meant as far as a patient being able to see you. Do they need a recommendation from another doctor, or can they see you directly?
No, they can call my office at GRMC, and we're glad to make an appointment. I would say that the majority of my patients do come from referrals from other physicians.
Right. Well, this patient would have a very long history and very checkered past with doctors. Have you ever, or are you willing to consider a patient for a recommendation for the use of cannabis?
I have not practiced in a state where marijuana has been legalized for medical use.
You do now.
Well, yeah, Guam is right on the verge of that, and I wouldn't be surprised if, before 2017 rings out, we see a change in the law.
Sir, we already have a law.
Oh, I didn't realize that it had been signed into law.
Yeah, it went into law back in December.
Okay.
And a patient can go to the health department, pick up the form, which I have.
Doctors are able to write certifications at this time.
Yeah, I would not have a problem writing for, as long as it was a condition that I recognized as a legitimate cause of chronic pain, and in discussion with the patient that they felt that it was helping them, I would not have a problem with that. But again,
that is wonderful news.
Yeah, it's as a physician, no matter what our specialty is, we try to stick with what we know. In other words, right. I'm a terrible cardiologist, but I do a good job on neurosurgery.
Right. Well, it's like Dr. Dombrowski, he's supposedly the go-to guy, but if you call his office or talk to anybody there, you can't actually talk to Dr. Dombrowski or see him. They'll tell you that he doesn't treat chronic pain.
Right.
And their office will not talk to you about, they won't talk to you about getting a certification for medical cannabis. And they even lied to me about doing cancer screenings.
Yeah.
So that's the kind of atmosphere we got to work here with on this island.
Well, thank you for your thoughts, Augie. We're going to continue on this conversation with Dr. Powell. Again, since we're along those lines, yes, doctors are now able to write certifications, and there is a prescribed form available at the Department of Public Health where doctors can utilize this form. This is the authorized or prescribed form that Public Health has issued, and maybe we can get Mr. Gillen on the line at some point before I leave to see if what doctors need to be able to get these forms and have them available to them. So, given that you've said you've not practiced in a state with legalized cannabis for medicine, we, again, as advocates, would like to bring. We've kind of been relying on the medical professionals to bring in their own people to help educate them. So that doctors can make better educated choices, whether they want to or not.
Sure.
We're not saying doctors need to do this. It's up to you. But what we would like to see in the medical community is for doctors to take the initiative to say, I'd like to get educated on it before I make a decision to write a certification or not write a certification. Because what we're seeing right now is, I'm not going to participate in that, before they even look into it. And so we appreciate the fact that you're open to and willing to consider it, especially probably 90% of your patients do have a chronic pain. Chronic pain is not on the list of conditions But there is a condition that says any condition your doctor recommends that cannabis could be helpful to you. And that would be something maybe neuropathic pain is on the list.
Yeah.
So
and I see quite a bit of that.
Yeah, so there are things, and we'd be happy to help you, Doctor, if there's anything or any information that you need that we could help pass along to you with regards to cannabis policy on Guam. We do appreciate that. If you would like help, or if you need to talk to Dr. Powell, you could call GRMC at 645-5500. I wanted to give you a chance to give us some final thoughts before you leave. I really do appreciate your time. You and Kevin. Thanks, Mr. Kevin Kerrigan, joining us here over at Sorensen. We're always happy to have him at home.
Yeah, and thank you, Andrea, for having me here. I'd say this. Chronic pain is a real problem, and it requires multiple different modalities of treatment, meaning not just medicine, not just surgery, not just physical therapy, but often a combination of that and more. And patients will often say that their doctor isn't treating their pain adequately, and I would say to those patients, please reach out and get another opinion and find a physician that you can connect with. Network with other patients who are facing a similar condition as yours. There's a lot of resources out there, and don't give up, because it's extremely rare that we can't make your pain better.
Thank you so much again for your thoughts. Actually, real quick before you go, Doc, can we take Francis's call, Paul? And is that on one or... That's on one? Okay. Francis, Hoffaday, Francis.
How you doing, Andrea?
I'm good, thank you. Nice to hear from you.
Yes. You have a special guest, Dr. Powell?
Yes, Dr. Powell.
Yes, I was. My first question was to find out from Dr. Powell if he's receiving any referrals from for veterans. Veterans referral?
Yes, I am. And in fact, before I came here, I'd been working for the Department of Defense, seeing both active duty and veterans. But yes, I am taking veterans.
Thank you. We're working with the Tri-West and the VA, and are you at the new hospital, the GRMC?
That's right, the new one.
All right. I have about 24 hours before Tri-West decides who am I supposed to see, and I'm thankful that you're there and giving us a little hope here, because I was beginning to think that we didn't have any source of or specialist, like yourself. You're a neurosurgeon?
I'm a neurosurgeon, that's right.
Thank you very much for being in the island.
I'm enjoying it here, Francis, and thank you.
All right.
Thank you so much,
Andrea.
Hey, thank you so much, Francis. You can call GRMC at 645-5500 if you need any help. They'd be happy to help you, and if you need to be connected to Dr. Powell's office, they'll be happy to help you there too. Thank you again so much for taking the time, coming down here to talk to us in the studio. Chronic pain is a real thing.
It is very much a real thing, and it's a problem for millions of people.
Thank you so much.